Hey, my name is Emily, and together with Marwin and Sandra, we wrote a systematic review about ketamine, propofol or ketofol procedural sedation in children at the emergency department. In 2015, approximately 213,000 children aged between 0 and 18 years visited the emergency department in the Netherlands, of which many of these were associated with pain. Many procedures are painful or uncomfortable for the child, and so procedural sedation can be required to reduce pain and to allow safe completion of the procedure. However, there's a lack of consensus regarding which medication is the safest to use in such circumstances. This results in suboptimal quality of care, ineffective sedation, failed procedures, and patient harm. Did you even know that painful procedures such as catheterization and venipuncture are sometimes done without any sedation at all? The most common intravenous drugs are ketamine, propofol, and ketofol. Ketamine has a sedative as well as an analgesic effect. A known side effect is laryngospasm. However, unlike other sedatives, it has no effect on the respiratory system. Propofol, on the other hand, has a deep sedative effect and causes hypotension and respiratory depression. Ketofol is a combination of propofol and ketamine. It is believed that this combination might maximize beneficial effects, and due to a lower required dose of each drug, there might be fewer adverse events. To assess the safety of different drugs, we researched the adverse events documented during sedation in children. The adverse events which occurred are airway obstruction, apnea, aspiration, cardiac arrest, emesis, hypotension, laryngospasm, nausea, oxygen desaturation, and last but not least, unpleasant recovery reaction. We searched PubMed and Embase for eligible studies published between 2009 and 2018. The inclusion criteria were procedural sedation, ketamine, propofol or ketofol, and children aged under 18. We excluded any studies that were not written in English and which were not full text accessible through Erasmus MC. Our search resulted in 230 articles. After applying exclusion criteria and doing a full text analysis, we ended up with 18 articles we used for a systematic review. As you can see, the most common adverse events are nausea and oxygen desaturation. Ketamine has the highest incidence of nausea with 16.6%. However, propofol and ketofol have an incidence of less than 5%. When it comes down to oxygen desaturation, ketofol has the highest incidence with almost 8%, while ketamine and propofol have an incidence of less than 2%. The most severe adverse events are airway obstruction and laryngospasm. Ketofol has the highest incidence of airway obstruction with 2%. Ketamine and propofol, on the other hand, only have half of this incidence, namely both 1%. When we look at laryngospasm, ketofol again has the highest incidence of 0.7%, while ketamine and propofol have an incidence of less than 0.4%. Last but not least, the very severe but very rare adverse events were cardiac arrest and aspiration. Both of these were incredibly rare for all three drugs. However, as with all studies, there were certain limitations. Some of the adverse events have only been examined by a limited amount of studies, and thus the pooled frequencies rely on a lower number of samples. Furthermore, some studies were not consistent regarding the age range of the study population. We look forward to further research on the subject, especially whether age range influences the type of adverse events which occur. Our study aimed at the safest drug for procedural sedation in children in the emergency department. Based on the amount of adverse events, we concluded that propofol is the safest drug after all. So, when in pain, just give us a call. We'll be right there with some propofol